Welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, we will go through 20 NCLEX practical nurse multiple choice questions and answers. If you like this video, please share it with your friends. Let's begin.
1. A client is diagnosed with cancer and is told that surgery followed by chemotherapy will be necessary. The client states to the nurse, "I have read a lot about complementary therapies. Do you think I should try any?" The nurse should respond by making which appropriate statement? 1. I would try anything that I could if I had cancer. 2. You need to ask your health care provider about it. 3. No, because it will interact with the chemotherapy. 4. Let's talk more about the different forms of complementary therapies. Answer. 4. Rationale: complementary, alternative therapies include a wide variety of treatment modalities that are used in addition to conventional treatment to treat a disease or illness. These therapies complement conventional treatment, but they should be approved by the person's healthcare provider, HCP, to ensure that the treatment does not interact with prescribed therapy. Although the HCP should approve the use of a complementary therapy, it is important for the nurse to explore the complementary therapies first with the client, which would eliminate option 2. The statement in option 3 is inappropriate. Similarly, option 1 is an inappropriate response to the client. Option 4 addresses the client's question and encourages discussion. 2. The nurse is preparing to assist a client of Orthodox Jewish faith with eating lunch. A kosher meal is delivered to the client. Which nursing action is appropriate when assisting the client with a meal? 1. Unwrapping the eating utensils for the client. 2. Replacing the plastic utensils with metal utensils. 3. Carefully transferring the food from paper plates to glass plates. 4. Allowing the client to unwrap the utensils and prepare his own meal for eating. Answer. 4. Rationale: kosher meals arrive on paper plates and with plastic utensils sealed. Healthcare providers should not unwrap the utensils or transfer the food to another serving dish. Although the nurse may want to be helpful by assisting the client with a meal, the only appropriate option for this client is option 4. 3. The nurse is caring for a group of clients who are taking herbal medications at home. Which client should be giving instructions in regard to avoiding the use of herbal medications? 1. A 60-year-old male client with rhinitis. 2. A 24-year-old male client with a lower back injury. 3. A 10-year-old female client with a urinary tract infection. 4. A 45-year-old female client with a history of migraine headaches. Answer. 3. Rationale: children should not be giving herbal therapies, especially in the home and without professional supervision. There are no general contraindications for the clients described in options 1, 2, and 4. 4. The client asks the nurse about various herbal therapies available for the treatment of insomnia. The nurse should encourage the client to discuss the use of which product with a health care provider? 1. Garlic. 2. Valerian. 3. Lavender. 4. Glucosamine. Answer. 2. Rationale: valerian has been used to treat insomnia, hyperactivity, and stress. It has also been used to treat nervous disorders such as anxiety and restlessness. Garlic is used as an antioxidant and to lower cholesterol levels. Lavender is used as an antiseptic and fragrance for a mild sedative effect. Glucosamine is an amino acid that assists with the synthesis of cartilage. 5. The nurse is assisting with collecting data from an African American client admitted to the ambulatory care unit who is scheduled for a hernia repair. Which information about the client is of least priority during the data collection? 1. Respiratory. 2. Psychosocial. 3. Neurological. 4. Cardiovascular. Answer. 2. Rationale: the psychosocial data is the least priority during the initial admission data collection. In the African American culture, it is considered intrusive to ask personal questions during the initial contact or meeting. Additionally, respiratory, neurological, and cardiovascular data include physiological assessments that would be the priority. 6. The nurse is planning to reinforce nutrition instructions to an African American client. When reviewing the plan, the nurse is aware that which food is a common dietary practice of clients with African American heritage. 1. Raw fish. 2. Red meat. 3. Fried foods. 4. Rice as the basis for all meals. Answer. 3. Rationale. African American food preferences include chicken, pork, greens, rice, and fried foods. Asian Americans eat raw fish, rice, and soy sauce. Hispanic Americans prefer beans, fried foods, spicy foods, chili, and carbonated beverages. European Americans prefer carbohydrates and red meat. 7. The nurse consults with a dietitian regarding the dietary preferences of an Asian American client. Which food should the nurse suggest to include in the diet plan? 1. Rice. 2. Fruits. 3. Red meat. 4. Fried foods. Answer. 1. Rationale. Asian American food preferences include raw fish, rice, and soy sauce. African American food preferences include chicken, pork, greens, rice, and fried foods. Hispanic Americans prefer beans, fried foods, spicy foods, chili, and carbonated beverages. European Americans prefer carbohydrates and red meat. 8. An antihypertensive medication has been prescribed for a client with hypertension. The client tells the nurse that she would like to take an herbal substance to help lower her blood pressure. Which statement by the nurse is most important to provide to the client? 1. Herbal substances are not safe and should never be used. 2. I will teach you how to take your blood pressure so that it can be monitored closely. 3. You will need to talk to your health care provider, HCP, before using an herbal substance. 4. If you take an herbal substance, you will need to have your blood pressure checked frequently. Answer. 3. Rationale. Although herbal substances may have some beneficial effects, not all herbs are safe to use. Clients who are being treated with conventional medication therapy should be advised to avoid herbal substances with similar pharmacological effects, because the combination may lead to an excessive reaction or unknown interaction effects. Therefore, the nurse would advise the client to discuss the use of the herbal substance with the HCP. 9. A Hispanic American mother brings her child to the clinic for an examination. Which is most important when gathering data about the child? 1. Avoiding eye contact. 2. Using body language only. 3. Avoiding speaking to the child. 4. Touching the child during the examination. Answer. 4. Rationale. In the Hispanic American culture, eye behavior is significant. It is believed that the bad, evil eye can be given to a child if a person looks at and admires a child without touching the child. Therefore, touching the child during the examination is very important. Although avoiding eye contact indicates respect and attentiveness, this is not the most important intervention. Avoiding speaking to the child and using body language only are not therapeutic interventions. 10. A nursing student is asked to identify the practices and beliefs of the Amish society. Which should the student identify? Select all that apply. 1. Many choose not to have health insurance. 2. They believe that health is a gift from God. 3. The authority of women is equal to that of men. 4. They remain secluded and avoid helping others. 5. They use both traditional and alternative health care, such as healers, herbs, and massage. 6. Funerals are conducted in the home without a eulogy, flower decorations, or any other display. Caskets are plain and simple, without adornment. Answer. 1, 2, 5, 6. Rationale. The Amish society maintains a culture that is distinct and separate from the non-Amish society, and some members generally remain separate from the rest of the world, both physically and socially. Family life has a patriarchal structure, and although the roles of women are considered equally important to those of men, they are very unequal in terms of authority. Amish society rejects materialism and worldliness. Members value living simply, and they may choose to avoid technology, such as electricity and cars. They highly value responsibility, generosity, and helping others, and they often work as farmers, builders, quilters, and homemakers. The Amish use traditional health care and alternative health care, such as healers, herbs, and massage. They believe that health is a gift from God, but that clean living and a balanced diet help maintain it. They may choose not to have health insurance and instead maintain mutual aid funds for those members who need help with medical costs. Funerals are conducted in the home without a eulogy, flower decorations, or any other display. Caskets are plain and simple, without adornment. At death, women are usually buried in their bridal dresses. 11. Which is a recommended guideline for safe computerized charting. 1. Passwords to the computer system should only be changed if lost. 2. Computer terminals may be left unattended during client care activities. 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. 4. Copies of printouts from computerized files should be kept on a clipboard at the nurse's station for other nurses to access. Answer. 3. Rationale. After any inadvertent deletions of permanent computerized records, the nurse should type an explanation into the computer file with a date, time, and his or her initials. The nurse should also contact the nursing manager or supervisor with a written explanation of the situation. Options 1, 2, and 4 represent unsafe charting actions. Only option 3 follows the guidelines for safe computer charting. 12. The licensed practical nurse, LPN, enters a client's room and finds the client sitting on the floor. The LPN calls the registered nurse, who checks the client thoroughly and then assists the client back into bed. The LPN completes an incident report, and the nursing supervisor and healthcare provider, HCP, are notified of the incident. Which is the next nursing action regarding the incident? 1. Place the incident report in the client's chart. 2. Make a copy of the incident report for the HCP. 3. Document a complete entry in the client's record concerning the incident. 4. Document in the client's record that an incident report has been completed. Answer. 3. Rationale. The incident report is confidential and privileged information, and it should not be copied, placed in the chart, or have any reference made to it in the client's record. The incident report is not a substitute for a complete entry in the client's record concerning the incident. 13. An unconscious client, bleeding profusely, is brought to the emergency department after a serious accident. Surgery is required immediately to save the client's life. With regard to informed consent for the surgical procedure, which is the best action? 1. Call the nursing supervisor to initiate a court order for the surgical procedure. 2. Try calling the client's spouse to obtain telephone consent before the surgical procedure. 3. Ask the friend who accompanied the client to the emergency department to sign the consent form. 4. Transport the client to the operating department immediately, as required by the healthcare provider, without obtaining an informed consent. Answer. 4. Rationale. Generally, there are only 2 instances in which the informed consent of an adult client is not needed. One instance is when an emergency is present and delaying treatment for the purpose of obtaining informed consent would result in injury or death to the client. The second instance is when the client waives the right to give informed consent. Options 1, 2, and 3 are inappropriate. 14. The nurse arrives at work and is told to report, float, to the pediatric unit for the day because the unit is understaffed and needs additional nurses to care for the clients. The nurse has never worked in the pediatric unit. Which is the appropriate nursing action? 1. Call the hospital lawyer. 2. Call the nursing supervisor. 3. Refuse to float to the pediatric unit. 4. Report to the pediatric unit and identify tasks that can be safely performed. Answer. 4. Rationale: floating is an acceptable legal practice used by hospitals to solve their understaffing problems. Legally, the nurse cannot refuse to float unless a union contract guarantees that the nurse can only work in a specified area or the nurse can prove lack of knowledge for the performance of assigned tasks. When faced with this situation, the nurse should identify potential areas of harm to the client. 15. The nurse enters a client's room and notes that the client's lawyer is present and that the client is preparing a living will. The living will requires that the client's signature be witnessed, and the client asks the nurse to witness the signature. Which is the appropriate nursing action? 1. Decline to sign the will. 2. Sign the will as a witness to the signature only. 3. Call the hospital lawyer before signing the will. 4. Sign the will, clearly identifying credentials and employment agency. Answer. 1. Rationale: living wills are required to be in writing if signed by the client. The client's signature either must be witnessed by specified individuals or notarized. Many states prohibit any employee from being a witness, including the nurse in a facility in which the client is receiving care. 16. The nurse finds the client lying on the floor. The nurse calls the registered nurse, who checks the client and then calls the nursing supervisor and the health care provider to inform them of the occurrence. The nurse completes the incident report, for which purpose? 1. Providing clients with necessary stabilizing treatments. 2. A method of promoting quality care and risk management. 3. Determining the effectiveness of interventions in relation to outcomes. 4. The appropriate method of reporting to local, state, and federal agencies. Answer. 2. Rationale: proper documentation of unusual occurrences, incidents, accidents, and the nursing actions taken as a result of the occurrence are internal to the institution or agency. Documentation on the incident report allows the nurse and administration to review the quality of care and determine any potential risks present. Options 1, 3, and 4 are incorrect. 17. The nurse observes that a client received pain medication 1 hour ago from another nurse, but the client still has severe pain. The nurse has previously observed the same occurrence. Based on the Nurse Practice Act, the observing nurse should plan to take which action? 1. Report the information to the police. 2. Call the impaired nurse organization. 3. Talk with the nurse who gave the medication. 4. Report the information to a nursing supervisor. Answer. 4. Rationale: Nurse Practice Acts require reporting the suspicion of impaired nurses. The State Board of Nursing has jurisdiction over the practice of nursing and may develop plans for treatment and supervision. This suspicion needs to be reported to the nursing supervisor, who will then report to the Board of Nursing. Options 1 and 2 are inappropriate. Option 3 may cause a conflict. 18. A client has died, and the nurse asks a family member about the funeral arrangements. The family member refuses to discuss the issue. Which is the appropriate nursing action? 1. Show acceptance of feelings. 2. Provide information needed for decision-making. 3. Suggest a referral to a mental health professional. 4. Remain with a family member without discussing funeral arrangements. Answer. 4. Rationale: the family member is exhibiting the first stage of grief, denial, and the nurse should remain with the family member. Option 1 is an appropriate intervention for the acceptance or reorganization and restitution stage. Option 2 may be an appropriate intervention for the bargaining stage. Option 3 may be an appropriate intervention for depression. 19. A nurse lawyer provides an education session to the nursing staff regarding client rights. The nurse asks the lawyer to describe an example that may relate to invasion of client privacy. Which nursing action indicates a violation of client privacy? 1. Threatening to place a client in restraints. 2. Performing a surgical procedure without consent. 3. Taking photographs of the client without consent. 4. Telling the client that he or she cannot leave the hospital. Answer. 3. Rationale. Invasion of privacy takes place when an individual's private affairs are intruded on unreasonably. Threatening to place a client in restraints constitutes assault. Performing a surgical procedure without consent is an example of battery. Not allowing a client to leave the hospital constitutes false imprisonment. 20. An older woman is brought to the emergency department. When caring for the client, the nurse notes old pneumatic areas on both of the client's arms and buttocks. The nurse asks the client how the bruises were sustained. The client, although reluctant, tells the nurse in confidence that her daughter frequently hits her if she gets in the way. Which is the appropriate nursing response? 1. I have a legal obligation to report this type of abuse. 2. I promise I won't tell anyone, but let's see what we can do about this. 3. Let's talk about ways that will prevent your daughter from hitting you. 4. This should not be happening. If it happens again, you must call the emergency department. Answer. 1. Rationale. Confidential issues are not to be discussed with non-medical personnel or with the client's family or friends without the client's permission. Clients should be assured that information is kept confidential unless it places the nurse under a legal obligation. The nurse must report situations related to child, older adult abuse, and other types of abuse, depending on state laws, gunshot wounds, stabbings, and certain infectious diseases.